This is a new installment of Petrini's EVH Pearls. In this video, I'll be demonstrating the importance of the position of the conical tip to make branch taking easier and more consistent. Window anterior branches distally using counter traction with your inside hand. Then open the windows with the bipolar blades, sealing any vessels in the soft tissue. Having a conical tip and bipolar blades to utilize at all times makes branch taking more efficient. Advance blades halfway out, then position your conical tip 2 to 3 millimeters past the branch on the inside of the vein. Close on the branch with a slight 1 to 2 millimeter twist toward the conical tip. Open and close the blades while the bipolar cautery is engaged. Continue opening and closing the blades until the branch separates from the soft tissue and tunnel wall. The branch is sealed distal to the vein with minimal thermal spread.